Being a caregiver to a patient with Parkinson's disease can be challenging and sometimes overwhelming. You have to change your lifestyle to accommodate the person who is in need of your help. As the disease progresses, the need of your help will increase as well. Supporting a patient with Parkinson's disease in their challenges of daily life needs encouragement and strength. The patient with Parkinson's disease needs your support in order to live as independent as possible. Even though there is no permanent cure for Parkinson's disease, the symptoms of the disease can be managed effectively in order for the patient with Parkinson's disease to lead a productive life. In the early stages of Parkinson's disease, your emotional support and encouragement may be all that is needed. But as the disease progresses, your physical support will be necessary to the patient who alters their activities to accommodate their condition. The caregiver can aid the healthcare providers by providing the necessary information and keeping close contact with each member of the healthcare team. As a caregiver, you are the bridge between the team and the patient. Only you can observe how the patient is doing on a daily basis. Your continuous communication is an integral resource for the healthcare team to know how the patient is doing and what needs to be done further to help improve the quality of life of the patient. The primary caregiver is also very important in the daily intake of patients' medications. You can help by keeping track of how effective the medication was and if any side effects were caused by medication. Compliance may be an issue for some patients. Sometimes the lack of improvement is due to patient not taking the medications as instructed. You as a caregiver can be the one to make sure that the patient does not forget to take the medications on time. You should watch the behaviors that may indicate depression, such as social withdrawal and anxiety. In such a case, you should be compassionate and supporting. You should try more social activities with patients of Parkinson's disease and ask for help if needed. Being a caregiver can be increasingly challenging as the disease progresses. Patients with Parkinson's disease may have more difficulty with memory, cognitive functioning, depression, anxiety, and hallucination as the disease progresses. You should take a break for yourself periodically. No matter how dedicated you are, you will need some time to recharge your batteries. You should accept support and distribute some of the tasks to the people who are willing to help. If you are feeling down, you should find somebody you can trust and talk about your feeling and ask for help. There are many ways you can get help in your community, such as adult daycare centers, community care access programs, Meals on Wheels, and short-term rehabilitation programs. This information is provided for educational purposes only and should not be taken as a substitute for the medical care and advice of your physician.